Open enrollment for Medicare kicks off in a few days, and whether you're planning for your needs or maybe your mom or father or grandpa and grandpa, Nick Karl with People's Health is here to talk about the enrollment and some common myths to Medicare. So you can hold up my true and false cards, I guess. The first one Nick suggests is Medicare is only for people 65 and older, right?
That is false.
We need a buzzer. Really?
It's not. It's for people 65 or older or anybody with disabilities that is receiving Social Security disability benefits for 24 months.
Okay. And a commonly misconception that it's just for...
That's exactly right. People think it's just for people 65 and older.
Okay. You can enroll at any time, right, Nick?
That is not true. That is actually false. There we go.
There we go.
So it's really, you can enroll.
The critical point there is it's coming up.
That's exactly right. It's here. It started Monday, October 15th, and it runs through December 7th for a January 1st effective date is the Medicare annual enrollment period.
All right, we're through one into the mix here to go the other way. Medicare does not cover all routine expenses.
That is true. So Medicare doesn't cover things like routine vision. It doesn't cover dental and vision, those types of benefits that some Medicare Advantage plans do cover.
All right, so that's important to know if you want that coverage, or if you want that coverage for, an elderly person who you're helping to make those decisions as, the country ages.
Yeah, that's exactly right. I mean, cost does come into play, and people want the most benefits they can get out of their plan, and a lot of times a Medicare Advantage plan is the best option.
And here's one. Everybody pays the same, right, Nick?
That is false. So Medicare Part B premium is income adjusted. So if you make over $85,000 a year, you pay more in a Part B premium, or there are plans now that cover part of the Part B premium. So people should really do their homework and take a look and see what's best for them.
And then, one of the common misconceptions is that there are two parts to Medicare.
That is false. There's actually 4 parts to Medicare. Part A covers your inpatient hospital care. Part B covers your outpatient doctor's visits. Part C is Medicare Advantage plans like People's Health, where we contract with Medicare and offer you all your benefits.
What is the most common mistake that people make when they are ready for year number 1? And you've been in a health plan maybe your whole life, if you're fortunate enough to be working for an employer who provides it, and suddenly the world changes on you.
Yeah, the biggest mistake is they just go with what they're comfortable with and join a plan that then they don't do their homework, they don't look and make sure that their prescription drugs are covered, or they're not getting the most benefits out of their plan. Sometimes doctors or networks change, and they just assume just because it's branded one plan that it's the same thing, and that's not always the case.
All right, Nick Karl, we appreciate the helpful tips as we're in this critical part of the year. And also props to our sound effects man for picking up on that. We're not fooling around here on the Fox 8 Morning Edition.